Steube, you're recognized.
Thank you, Mr. Chairman. Mr. Fleece, thank you for all the work that you've done in my district. The number of home health providers has declined significantly. Excluding California, the number of agencies serving beneficiaries has dropped by 17% since 2019, from 7,793 to 6,468. A publicly traded home health company recently announced the closure of multiple agencies, particularly in rural areas, citing reimbursement cuts as the primary reason. Can you provide insight into the factors driving this widespread closure of home health agencies, and do you believe current reimbursement policies are sustainable for providers?
Thank you, Congressman Steube, and we do thank you for your service to the district where Empath Home Health serves, as well as Tidewell Hospice, so thank you, sir. Ultimately, home-based care is so much of the solution to many of the questions and many of the problems that have been identified today at this subcommittee. Ultimately, as I co-authored in my book, The New Health Age, how we think about healthcare, how we deliver healthcare, and the economics of healthcare must change. And there are many, many reasons behind that. I concur that there are various models within the home-based care environment that are driving especially smaller home-based care agencies out of business, and even for larger not-for-profit organizations like myself, caring for 80,000 Floridians a year. Programs like PDGM, programs like Review Choice Demonstration, the complex OASIS tool that our staff are forced and required to comply with, while well-intended when enacted, certainly do require further consideration to reduce administrative burden, to ensure that home-based care and patient care survives. And in all due respect, in my final comment to one of my panelists that's testifying today, I practiced healthcare law for 25 years and have been in healthcare for 30, serving as a CEO or president of this organization, and I'm hard-pressed to find a lot of home care agencies as identified by MedPAC with 20+% margins. We are operating at a 2%, that's 2% net operating margin across Empath Health and the care continuum, and our home health care division is operating at a net loss.
And under the new home health payment systems, are payments covering providers' costs?
Absolutely not, Congressman.
And how inadequate are fee-for-service payments relative to costs?
Inadequate. And when Medicare Advantage is continuing to grow, while there are good implementations and 5-star rated Medicare Advantage plans across this country that has been long-standing, we need to continue to move towards a pay-for-performance model and also pay the 4- and 5-star hospice and home health agencies more so that we're paying for performance under the model.
And can you speak to your experiences with prior authorization? Are most of the requests approved? How does this impact the care received?
So I would ask for the Congress here today to imagine one of your loved ones in either hospice or home health, and they are in need of post-acute care. Every second, every minute is critical to get them out of the hospital into a home-based care environment. We both participated under the Medicare Advantage carve-in pilot on the hospice side, and we contract with Medicare Advantage plans today. It adds hours, days to the pre-authorization process and delays access and delays care. Oftentimes on the hospice side and sometimes even on the home care side, patients literally die during the discharge planning process waiting for the authorization, Congressman.
In the little bit of time I have remaining, is there any issues you'd like to address that you haven't had the opportunity to address so far?
Thank you so much, Congressman. One thing I can guarantee every congressperson here today is that we will all die. If I compel you to take one takeaway today from this subcommittee hearing, it's preserve the end-of-life care benefit that hospice has been known for over 45 years in the Medicare benefit. Thank you so much.
I yield back. Thank you for being here.